If you think about what we're trying to do as a company, we're trying to tackle pain at its source, dysfunction at its source, right? So the very root of what's going on is buried under a lot of movement dysfunctions, right? And sometimes those behaviors are with us for months and years. So certainly the goal of each menu is to get you relief each and every time. But the goal also is to keep you in that relief. And that's going to take a little bit longer, right? I guess it also depends on each person individually as to like what their symptoms like, or, you know, what their limitations are. So it can vary, but generally what I advise to my clients is you should feel relief each and every time. And the goal is to make that relief last longer until your body's ready for the next step.
Yeah, similar to what Mike was saying. When it's how long is this going to take? One thing to consider is how long did you unconsciously train your body to be in this position in the first place? If only all we needed was just one time to undo all these things. So just to bear in mind, you have this amount of time enforcing one habit, and you're going to need to put in some consistent patterns of behavior to offset that. So I say, first we are unlearning what your body has hardwired. Then you are replacing those habits with more functional, more aligned, like a more aligned position and more functional habits. And then we want to strengthen that. So bearing in mind that those are a few phases that we need to get through. Expect to be consistent with your menu, expect to put in the time for yourself. That said, you should notice a difference immediately, right away, as soon as you introduce the stimulus to your body. So you should feel a difference every time you do your menu. You should feel a difference the first day. But with regards to, as Mike said, holding this and keeping it how you want it, just be mindful that we're trying to offset a pattern you've had in your body for a while. And that depends on how hardwired the habit is.
Cool. And I would also add too that, because everybody is different, everybody has different goals. So I also like to make sure, what is our client wanting in terms of like what's their impression or what's their idea of being done. There's that first level, which is I just want to be out of pain, which, depending on the severity of the dysfunction or how long your compensations have been there and what we're working through, that could probably be accomplished if you're consistent and you do the work and you put the time and communication in, maybe a few weeks. If your goal is to be ready to go skiing or go running or, be able to go on a backpacking trip, that's also going to dictate how much function are we retraining, where do we need to get your body to be? And then that would also play into, how long it will take is also, just where is the client looking to go with this besides get out of pain? Because, like we've all experienced, it can go away in one day, it can go away in a couple of weeks. But what are we really trying to get back to? Because there's a lot of modalities that can take away your pain. But if your goal is you want to go for a walk for more than, 10,000 steps or go on a hike or go surfing, it's going to take a little bit more work, but you'll be able to do that as opposed to just putting it on the back burner and, join the population of, I used to do that, but then I got older. We're working to get back to goals and get back to a lifestyle that maybe you thought you couldn't do again.
Yeah.
Yeah, absolutely. Yeah. Well said. Yeah. I would agree with all of that. And I think the idea of helping someone get out of pain, I think we'd all agree, is fairly easy. It's keeping you out of pain so that you can do what? And so with that in mind, if we put things on a scale of A to Z and it's where is that individual coming in at? Are you coming in at A, where you haven't done anything for the last 5 years or 10 years or 15 years, or like Emily's talking about hardwired or patterns that have been sort of ingrained in there, what gets fired gets wired. Are we stuck in these sort of routines, subroutines or subconscious routines that are like part of your normal everyday living or your activities of daily life? Are you sitting all the time and stuck in the same position all day long in everything you do? And then just sort of, your activity profile has shrunk down to I only get on the recumbent bike at the gym and I only do a couple of the machines because they don't hurt. So we've sort of just contoured our lifestyle to working around the symptom for so long So yeah, we have some unraveling to do, because the way that we're looking at the body is from a holistic perspective, and just again reiterating what you guys are saying. And it's not a removal of pain is the objective and we're done. It's removal of pain, and now let's go live life. So getting from A to B to C, if let's say that there's a threshold, and maybe that letter is F for somebody, that means that they're free of pain. And now what are all the other letters that you want to participate in? What are the activities and things that you gave up along the way? What are the normal routines and things that you're doing? So yeah, just maybe another way to say exactly what you guys have already said. Yeah, there's more to it. And I think one of the words that I think Emily's favorite word is sustainable. Like how do we keep it so that it's not a short-term intervention, but this is something that you can utilize the rest of your life. Quick story there. I was on a golf course. So speaking of golf, just randomly got paired up with this guy, and he must have been in his probably 70s at the time, but he's out there and swinging. So what do you do? Oh, I work for this company and we do posture correction. And he's like, oh, is he Egoscue? Like, yeah, Egoscue. And he was like, oh, I love that place. Fixed my back. I used to get this nerve stuff running down my leg, and I don't have it anymore. It's amazing. And so I was like, cool. And what are you doing now? And he's like, oh, I still do my stuff. And he's, well, how long? It was 10 years ago I did it. And so I'm still doing my stuff every day. And he's like, every hole, he's like remembering, like, and I do this one where I hang my heels off the big, and then I do this one. It was funny. But it was a great example of, this isn't a short-term fix, where we're just like trying to snap our fingers, wave a wand and get you out of pain. This is like principles that we're applying, and then a practice that we get to employ, or we as individuals, or you as the client, get to employ to actually take charge of your own health and not be stuck where you are in a like a symptom cycle. So
good old Egoscue.
Egoscue, yeah.